Hi, my name is Dr. Rubin, and I've seen a lot of content lately that is misinformation surrounding human metapneumovirus and trying to compare it to COVID-19. I highly doubt that human metapneumovirus is going to cause widespread lockdowns like what we saw in March 2020 due to SARS-CoV-2, the virus that causes COVID-19. But since it's been almost 5 years since those lockdowns, I want to give you a little bit of a reminder of why we had those lockdowns to begin with. Unlike human metapneumovirus, which has been circulating for over 20 years, and there is a level of population immunity, meaning people have been exposed to it previously, SARS-CoV-2 in 2020 was a brand new virus, and there were no vaccines. We did not really understand that virus and how it operated, and it caused oftentimes in the beginning of the pandemic delayed transmission where somebody would get infected and they would be spreading it to other people without realizing it because they didn't have symptoms, and it would take several days before symptoms would develop. So this would cause widespread infections at a time when we had limited resources in the healthcare system to be able to take care of the numerous amount of patients that were getting very sick and ending up in the hospital with respiratory distress and other complications. So in order to slow the spread of that virus, the lockdowns were put in place to physically distance people, which helped save lives. Personally, I am much more concerned about H5N1 bird flu compared to human metapneumovirus because the previously reported case fatality rate for H5N1 bird flu is about 50%. I doubt it would be that high if there was sustained human-to-human transmission, but it still could be a very significant pandemic if that virus turns out. I doubt, though, that there would be widespread lockdowns for that virus as well because there's going to be vaccines likely available to help treat this. And we understand influenza a lot better than we did SARS-CoV-2. Plus, wearing masks over your nose and mouth can significantly reduce the risk of transmission of these viruses, including influenza, which one strain was essentially wiped off the map because people were masking for a prolonged period. If I hear anything else that is of importance regarding these issues, I will let you know in the future, so hit that follow button to stay informed.